This is my third lecture on hemovigilance. This is part of my series of lectures on blood banking. Today I'll talk about donor adverse reactions and I'll talk about donor adverse reactions reporting in the context of Hemovigilance Program of India. The objectives of the National Donor Hemovigilance Program of India are to improve donor safety and satisfaction through monitoring, analyzing, and researching adverse events. To analyze risk factors, implement and evaluate preventive measures, to provide evidence-based support for blood donation process improvement, to reduce the frequency of adverse events, to increase donor frequency. In addition to these, the objectives are to identify the trends in adverse events and reactions, to determine risk factors and raising awareness, to provide evidence for the development and amendment of policies to improve practices, and guiding research. This is the diagram I have taken from the document of Hemovigilance Program of India, the reporting of donor reactions. First of all, the blood center has to be registered with the NIB in India, and the blood center is then issued user ID and password. Then, in case of any adverse donor reactions, these are the details are uploaded by the donor vigil software, and the data is analyzed, and the recommendations are forwarded to Indian Pharmacopoeia Commission for further action. These are the classifications of donor adverse events or reactions, and these are classified like local symptoms, complications mainly with generalized symptoms, that is vasovagal reactions, complications related to apheresis, allergic reactions, serious complications, and other reactions. These are the local symptoms, and these include blood outside vessel, arm pain, localized infection, inflammation, other major blood vessel injury. Blood outside vessel include hematoma, arterial puncture, delayed bleeding or rebleeding. Arm pain include nerve injury, irritation, and other arm pain. Localized infection, inflammation along the course of vein include thrombophlebitis and cellulitis. The major blood vessel injury are serious conditions needing specialist medical diagnosis and attention, and these include deep vein thrombosis, arteriovenous fistula, compartmental syndrome, brachial artery pseudoaneurysm. All these local symptoms are then graded into grade 1, 2, and 3 depending on severity. And the grading depends on whether there is a need for outside medical care, or whether there is need for hospitalization, or there is hampering of activity of daily living for less than or more than 2 weeks. And so this is the grading scheme of local symptoms. Then the generalized symptoms, that is vasovagal reactions, they are classified as without loss of consciousness or with loss of consciousness. With loss of consciousness may be for less than 60 seconds or more than 60 seconds. Another way of classifying vasovagal reactions is with injury and without injury. It may also be classified as within blood collection facility or outside blood collection facility. The vasovagal reactions are graded into grade 1, 2, and 3, similar to the grading of local symptoms, depending on whether there is a need for medical attention, whether there is a need for hospitalization, whether there is hampering of activity of daily living, whether there is a need for suture of laceration or IV dehydration or dental injuries, fractures. So this is the basis of grading the severity of vasovagal reactions. Then the complications related to apheresis include citrate reactions, that is muscle spasm, hemolysis, air embolism, infiltration, infiltration of IV fluids. This is the grading scheme of complications related to apheresis, and the idea is very similar to grading of the previously described adverse reactions. Then allergic reactions can be classified into local or generalized reactions, and generalized reactions include anaphylactic reactions. And this is the grading of allergic reactions. This depend on, like previously, whether medical attention is required or hospitalization is required, or there is a need for inhaler or bronchodilator, or there is a need for intravenous steroids or epinephrine, or intubation or tracheostomy. Then these are the serious complications under adverse donor reactions: acute cardiac symptoms, myocardial infarction, cardiac arrest, transient ischemic attack, cerebrovascular accident, and unfortunately death. These are also graded with similar to the previous scheme. Then there may be other complications which are not listed otherwise, and these are also graded similarly. Then this is the method of imputability, and this is divided into these labels as definite or certain, probable, possible, unlikely or doubtful, and excluded, and these are self-explanatory. So this is all for today. Thank you very much.